And we are live, Senators.
Thank you very much. It is still Wednesday, February 22nd, and we are still the Senate Health and Welfare Committee. We had a break for a lockdown event, practice drill in the State House. So that, for those of you who are out waiting for us, that's what has been going on. But we are on schedule to take testimony on S56. And before we do that, I know I handed out to the committee a flyer from Viva about the Medicaid renewals and restarting. And as we all know, folks have been on Medicaid during the pandemic, and there hasn't been any redetermination about their eligibility for Medicaid. So that eligibility redetermination is beginning in March or coming in April. I don't want to say the wrong month. And folks who are currently on Medicaid will be evaluated for their eligibility for Medicaid. The sheet that I'm going to have, Alex, if you don't mind trying to get this posted for us. And so it will be posted on our webpage. It's from Viva, very helpful, has questions, frequently asked questions on it. It will help us work with our constituents, but it will also help our constituents be informed about what they need to do in order to find out if they're still eligible for Medicaid. So that's it. And these flyers are available. I think we can get some more for you if you want. Okay, so we are now moving on to S56, and just a couple of words about S56. Posted on our webpage, I asked Katie to go through, based on our committee work, we're going to continue to work on childcare. That is our goal in here. And I've asked Katie to take out the pre-K language. There is a section 1 that is a placeholder for pre-K. But the rest of the bill, section 2 and forward, has childcare, all of our childcare sections in it. And this will allow for us to go through the bill based on the testimony that we've heard and to do some markup on the bill. Today, and so the Education Committee will be looking at the pre-K work, and our committee has taken significant testimony on where the gaps lie, so we can help inform. And 3 of you are already on education, but 2 of us are very interested in this. But we can inform the Education Committee about questions that and gaps that we've identified in here through our testimony. So that's the process. So our process today is to begin to work collaboratively with the Agency of Human Services and to hear testimony from the agency. And I don't see Heather Boucher here yet. Also, agency AOE is going to be coming in as well. Do you want to hold off, Miranda, until she's here, or Katerina?
I can check in with Heather right now, but I believe she's on her way.
She's on her way. Okay. So you want to start without her, or how do you want to do this?
I think I can start without her, so we'll just move things around a little bit. And when she gets in, I'll just.
And then we can be flexible in how this happens. We're good. Okay. So we have.
Oh, they're not for me. Oh, holy cow!
I'm going to ask you to get copies of the latest draft that Katie has brought us. We each need a printed version of that bill.
And Laura and Susan are here.
Oh, terrific. Okay, so we did have Lauren Hogan for the Association of the Education of Young Children. Would you mind if we started?
No,
That's good. I think that will help you.
Yay!
And we also have Susan Titterton from the Vermont Association. So welcome to both of you.
Thank you.
And we're going to introduce ourselves so that you both know all of us, and we then will meet you as you introduce yourselves for the record. So we'll start with Senator Williams.
Good morning, Senator Terry Williams from Rutland District.
Hi, I'm Senator Ruth Hardy from the Addison District. Hi, Martine LaRock Ulick from Chittenden Central.
Good morning, Dave Weeks from Rutland County.
And good morning, Jenny Lyons from Chittenden Southeast, and thank you both for being here with us. We look forward to your testimonies. Why don't you introduce yourselves? I don't know, are you working together with this, or are you going to do separate?
I'm going to present first, and then I'm going to hand it over to Susan.
Terrific.
Wonderful. Hi, well, good morning, everybody. Thank you all so much for the honor of inviting me to speak with you all today about Senate 56. I'm Lauren Hogan. I'm the Managing Director for Policy and Professional Advancement at NAEYC. We're a nearly 100-year-old institution. We're the professional membership association for the early childhood field. It's our mission to promote high-quality early learning for all children birth through age 8, with support and partnership from our 51 affiliates throughout the country, including an amazing affiliate right here in Vermont. We collectively advance a diverse, dynamic early childhood education profession, and we support all who care for, educate, and work on behalf of young children. It's for that reason, among others, that my comments today are going to be focused on the early childhood education workforce. And I hopped on just in time to hear you talk about the focus on the childcare portions of the bill. I'm really excited to talk about those that sort of recognize and value the early childhood profession and drive those investments in professional compensation and benefits. You'll hear from our partners. Yeah.
So just to let you know that there is a new draft of the bill 1.1 that we'll be working from. And so your comments about childcare are right on target.
Perfect. I'm always glad if they're helpful. So that'll be great. You'll be hearing from, obviously, our colleagues from my AUIC immediately after my own testimony. So I'm actually going to take some time briefly to sort of set the stage for some of the national level work that connects to and supports the work right here on the ground in Vermont and provide some additional background and context. So Alex, I think I can share my screen. Let me make sure. All right. Can y'all see what I've got going on? All right. So I'm going to talk just a little bit about sort of why this focus on the early childhood workforce, and please feel free to ask questions. Obviously, I have time at the end, but it's when I'm sharing, it's harder to see. So this is really about a focus on the early childhood workforce. What we know about the situation in childcare and early learning right now is that families can't find or afford childcare because compensation is too low to attract and retain early childhood educators. Relatedly, investments in the compensation and education of the workforce are the key to driving the supply and quality and affordability of childcare. All of these pieces are interconnected. I just want to recognize NAEYC, starting from the very early days of the pandemic in March of 2020, has been doing a series of surveys of the early childhood field to really help us get an understanding of what's happening on the ground. This is our most recent, just a snapshot of our most recent data from November of 22. So just a few months ago. The Vermont data is on the left-hand side, the national data is on the right-hand side. You can really see here, we asked about the staffing and supply challenges. And we're seeing, nearly 50% of childcare center directors are serving fewer children than they would like because they don't have enough staff. Classrooms, programs are closed, and this is having a real-time impact on children and families. 50% of those with the staffing shortage say they're serving fewer children, reporting a longer wait list. So those are the current challenges that we're having in the workforce that is impacting children and families and businesses, again, who are trying to hire and can't because people can't participate in the labor workforce because of the lack of childcare availability to them. We also have future challenges. We've got nearly a third of the workforce who is indicating that they are considering leaving their jobs or closing their family childcare home. That would be catastrophic to the impacts if a third of educators left, closed. What we would see happen to the availability and affordability of childcare would just put us into this cycle. When we ask them what they need to stay, the number one thing they need across the board is competitive wages, which is exactly why this bill represents incredibly exciting progress. And we were thrilled to see the innovative and creative and important efforts here that are about systematically providing this access to quality. So I just want to touch on a couple of pieces that really make this, that make a solution to the challenges that we know and are seeing on the ground. One of the really important things that the bill does is expands eligibility and increases child care assistance rates using this cost of care model. The reason eligibility is so importantly tied to compensation is because it is how we reach scope and scale that's required to help programs raise wages without simultaneously raising costs. Getting close, and I know this is part of the conversation, but getting close to universal eligibility is what provides that needed stability for programs and for families. So it really is incredibly important to reach those high levels of eligibility and ensure that families have access so that programs have the scope and scale that they need. Two other really important parts of the bill, as you all know, is investing in the education and professional pathways of the workforce. We loved seeing the pieces on scholarships and loan forgiveness. And I just want to call out the substantial role that institutions of higher education have in this preparation for early childhood educators and the need for investments in the higher education collaborative. Susan will talk a little bit more about the work that is happening on the ground, but there's so much wonderful work to build on. We really want to reference and build that into the legislation where possible. The final piece is really the direct investments in the compensation of the workforce. So true cost of care really relies on understanding a recognition of true parity. If we build cost of care based on current wages, which hover around $12 an hour, we're not going to solve the problem of actually making sure that programs are getting what they need in order to cover that cost. So this is about being inclusive of and implemented in all early childhood settings, recognizing the role that educators must play in the design of this. It's really so much of what we've done is built on what educators themselves have told us that they need in order to build a system that works for them and their families and the kids that they serve, and the need for attention to benefits as well, especially when we see movement between early childhood settings, childcare centers to public schools and or leaving early childhood just period for retail and food service. A lot of it has to do with the benefits that are available to them in other places, along with the wages.
Can we interrupt you with questions?
By all means.
Okay.
Thank you, Lauren. So going back to the previous slide, the first bullet, the second bullet, sub-bullet underneath the first line. I'm just curious, universal eligibility, what does that mean to you? Is that universal eligibility for child care assistance or universal,
Yeah, in this case, I'm talking specifically about child care assistance because in order to get to the ability of programs to raise wages for providers, essentially to make the market work in early childhood. I'm sure you all have heard from other testimony as well about just the challenges in the market of childcare. Without the supports coming in for families on using that childcare assistance, you end up in sort of a tug of war between being able to actually attend to families' affordability while also raising wages. When we get to a higher number of families who receive the child care assistance based on the cost of care model, you provide programs with the ability to actually pay educators without then raising tuition on other families who are not included in the eligibility standard.
Okay, so it's really, and I'm going to try to paraphrase, correct me if I'm wrong, it's really what what you're advocating in that line is essentially near universal eligibility for 0 to pre-K state-funded childcare. Is that,
Yeah.
okay, I just want to make sure I hadn't seen universal eligibility as a spin on this topic like that.
It's a real lever for increasing wages. The tie between those two pieces is
Okay,
not always obvious, but is important.
thank you.
Are there other questions?
No, go right ahead.
Feel free to ask along the way.
Okay, thank you. We'll do that.
I just wanted to make sure that we were rooting some of this again in Susan, again, is going to talk a little bit more about the work in Vermont. This is some of what's coming out of the unifying framework for the early childhood education profession. And this is about, and reflected in, I think, this bill, this goal of advancing an effective, equitable, diverse, well-prepared, well-compensated early childhood education profession. And this builds on work that we've done at the national and with many states in order to sort of advance this profession, really recognizing that this is both about childcare, pre-K, early childhood education. This comprehensive birth to 5 system is about both helping parents work and also about helping children thrive. So it's short and long term. The group of people who produced the unifying framework included these 15 organizations working together over the course of 3 years. The unifying framework itself was actually released on March 10th, 2020. So if you can put yourself in that frame, it was right as we were getting deep into the pandemic. This really means that we have a vision for getting to what we need in the early childhood education profession that is respected for its competencies, recognized for its value, and compensated in a way that allows families to have access to early childhood education that really works for them. Just very briefly, so that you have a sense of when we talk about the unifying framework nationally and in your state, it was put together with the profession. It was broad-based engagement, 11,000 early childhood educators engaging folks broad and deep in terms of that intentional engagement with communities of color, educators whose first language is Spanish, rural communities, incredibly important to be thinking about what kind of access and supports educators and families in rural communities have, obviously in Vermont, but in so many states as well, and in family childcare settings. So much of this work is really about saying who early childhood educators are, because when we're talking about compensation, we're talking about what we're compensating early childhood educators for. The recognition of a complex science, developmental, that is from birth to age 8, where early childhood educators care for and promote the learning, development, and well-being of children, and that they practice in all settings, right? This is not about the setting in which they practice. This is about their knowledge and skills and competencies. You'll hear Susan talk a little bit more about ECE 1, 2, and 3 designations. That comes from the unifying framework, where we're talking about a progress and a progression, a pathway for early childhood educators that is simplified and clear and understandable for educators themselves and for families, so that they're really able to move through that pathway and not sort of, sometimes, complexity can be very difficult to navigate. This is a way of thinking about how to make it simple and clear for folks to navigate through. One of the incredibly important parts of the unifying framework was establishing some principles around compensation that we've seen embedded in Senate Bill 56, which we're very excited to see, that there's comparable compensation with benefits, similar experiences and qualifications between, this is about parity, recognizing that parity is important, both in terms of recognizing value and frankly, in terms of making sure that people are able to work in the setting that works best for them and the families that they serve, that they're not forced to choose to leave one setting for another based solely on benefits that are available here, but not available here when the work that's being done is the same. Right now, if somebody earns an additional degree or credential, it doesn't necessarily result in increased compensation. And that's very hard for an early childhood educator when we're saying these are important skills and competencies. That increase in competence should be reflected in increased compensation. And to make sure, again, that we're recognizing the comprehensiveness, the importance of working with infants and toddlers and what we know about brain development in the earliest years, that we really can't compensate, we really shouldn't, and really need to think about how not to differentiate compensation based on the ages of the children served. And that's partly why that support for childcare and pre-K together are so important in thinking about how we really get to compensation across the board for a comprehensive birth to 5 system. I'll just add that everybody has a really important role to play. And when we were constructing the unifying framework, we looked very closely at other professions like nursing and speech language pathology and architects and plumbers and electricians, folks who were really made from a workforce into a profession and what that process was. What does it take to be an early childhood education profession? And what are the pieces that are built into this bill to help us advance collectively towards that long-term goal? We're really seeing Vermont lead, but not be alone on this. And so states and institutions of higher education are taking action in so many different ways, aligning to the ECE 1, 2, and 3 designations and pathways and compensation scales and lattices, really thinking about articulation and transfer to increase credential and degree attainment and completion, and really thinking about quality, coherence, and reducing bureaucracy actually through some of the accreditation processes, both higher education and early learning program, thinking about that quality piece to really drive the investments there on the higher ed program side and the early learning program side as well. I just wanted to take one more minute to talk about the partnership that exists for Vermont at the national level as well. While the task force ended when it released the unifying framework, we have the Commission on Professional Excellence in Early Childhood Education. And this commission is carrying forward the work in partnership with early childhood educators across states and settings. These are some of the members of the Commission on Professional Excellence. You can see a wide variety of national organizations who are working closely together on the implementation of the framework and some of the pieces that align with that. In addition to the organizational members, there are 11 educator members themselves with equal voting rights. It's a semi-autonomous body initially housed at NACCE, and one of the goals is really to partner with states in creating professional licensure structures and pathways and thinking about this vision. So this bill does an incredible amount to really recognize and center the early childhood workforce in all of these efforts. And we just wanted to provide some context for the work that's being done and that's embedded in this bill, and to know that the state has a partner, in NAOIC and with all of these other organizations nationally moving forward and other states as well as, again, a leader, but not alone. So I will stop sharing so that I can see all of you, and I'm happy to take any questions that y'all might have.
Thank you. Why don't you take that's perfect. Questions committee. So is Susan going to comment specifically on the bill, or how are you? And do we have your slides?
You do.
Check that first.
Yes.
Yes, okay. And then we have Susan's testimony. Okay, any questions for Lauren? But everything that you've talked about, obviously total cost of care, and then universal eligibility, all of those things are somewhat in the bill, or we're moving towards some of those things. But we also understand that if we did everything right now, it would be an extremely very costly endeavor. And so we're very aware of that in this building, because once we finish with this bill, it goes down the hallway to finance and appropriations, where it will die of its own weight if we have too much money in it, but we do appreciate your comments, and maybe you can circle back. I see you'd like to comment on that, and I'm glad to have you do it.
You know, cost is always a question, of course, and I work a lot on federal policy, and the federal government needs to be a partner to states in supporting the cost of early childhood education as well, and continuing to build on childcare investments and Head Start and early learning and all of the different ways to be able to move this forward. Would say that, you know, one of the things that, again, we think about when it comes to the question of cost is also the cost of what happens when we don't act, and being able to see, you know, if the early childhood education field collapses because there aren't early childhood educators, parents can't go to work and contribute in the labor force, that also impacts tax revenues for the state, and that impacts families who can stay in the state. All of those pieces also contribute to the revenue side and making sure that those funds are coming into the state as well. So, and that's a balance. You know, obviously some of the expenditures are first and some of the benefits come over time when, you know, everybody knows, I think, some of the long-term benefits and savings when we look at, you know, special education costs and crime down the road. But there are really immediate cost savings and supports and revenues as well when we see an increased labor force participation, because there is a functional childcare market that parents can depend on so that they're able to go to work. Again, it's nothing that you all don't know in terms of how to balance these things, but sometimes it's helpful to think not only about what's going into it, but also what comes out of it in order to provide some balance around that and make sure that the trade-offs are the things that make sense so that you're able to build a functional system.
Thank you. I think this committee is very much aware of prevention, and that's what you're talking about, and that's very helpful. I do have a question for both you and Lauren, and that is, as we were looking at your slides, you had a lot of organizations that are devoted to childcare and early childhood education. Do you work with any business groups that are investing in this work?
Absolutely. We work with a number of both sort of like small business organizations, as well as some of the bigger organizations, as well as some of the business sort of like individual businesses themselves who are thinking about ways to invest in supports for early childhood education and childcare. I think one of the questions is how to ensure that they're investing in that in a way that is community-based, so that they're adding to the entirety of the community supports for early childhood education and not thinking solely about their specific employees. But I think there are really ways to do that that are broad-based and supportive, you know, as a whole. The other thing I would add, of course, is the early, you know, childcare programs themselves are small businesses. And so really working closely with childcare programs as small businesses, whether they're sole providers and family childcare homes or small centers who themselves are providing employment in their community and, you know, being able to contribute from that lens. So really supporting their business models so that they can provide high quality care and support compensation for their educators as well.
Thank you. Senator Gulick has a question.
It's sort of a question and a comment. I was surprised, although I probably shouldn't have been, to see that the challenges we have in Vermont are mirrored nationwide from the data that you provided at the beginning. So I guess I'm curious, are there any major structural changes coming down from the federal government, or is it every state to themselves to try to fix this issue, or a combination of both? Because I mean, it's definitely been, for us, you know, couched as a state issue. So, and that may be a bigger question than we can answer right now, but I was startled to see the data.
It's remarkably consistent across states, actually. Again, there's some variation, but we were also struck by the similarities, I think, between states and what's happening on the ground. And the stories that we hear really co-sign on that data. Like, we are hearing a lot of challenges and fears. counterbalance, certainly in the states that are making progress like Vermont is, it's very exciting to see what some of the states, Vermont certainly among them, is doing to try to say, okay, we need to step up and do this work in our state. There's a lot of conversation at the federal level and efforts to think about how to structure childcare policy in ways that actually respond to the needs that states are sharing. So how are some of those changes that are, what are the kinds of changes that we need to see made? And the federal government has an obligation to continue making substantial investments. And we certainly fight for appropriations and continued investments every year as often as possible to get the states what they need to make the changes. And I think one of the things that we're seeing is just real innovation at the state level, some using federal relief dollars, for example, that came out of the pandemic, and ARPA dollars and other pieces, and really then building on some of those where the state is able to see, when we make investments in childcare and early learning, good things happen. And let's continue to build on those and find some ways to continue those investments, particularly on the side of the workforce, where we know that if we don't resolve the questions of compensation, we're going to keep circling on how we really make this field work in the short and the long term.
Okay, thank you. I think we'll move along to Susan, and I know you have a lot of written testimony that's directly related to the bill. So welcome, and please introduce yourself for the record, and then we'll listen to your testimony, and I'm hopeful that you'll read through and that we can, because we do want to get to the Agency of Human Services as well. So we'll welcome your testimony.
Thank you, Chair Lyons and respected committee members. Thank you for the opportunity to speak today. I am honored. My name is Susan Titterton, and since 2018, I've been the project coordinator for advancing early childhood education as a recognized profession, which is, as you know, an initiative of Vermont AEYC. Today, I have the privilege of speaking on behalf of the Advancing as a Profession Task Force, which is a group of early childhood educators from all over the state and from all sectors and settings, and really a wonderful group of individuals that I've had the pleasure to work with. And what we've been doing for the past few years is laying the foundation for advancing as a recognized profession. This is consensus-based work. We've engaged well over 1,000 members of the workforce. In fact, we count probably over 3,000 individual contact points and over 200 group sessions in determining whether they would want to move forward as a recognized profession and how that might look, and building that on the foundation of the unifying framework, as Lauren mentioned to you. So first, I'd like to use my slides to give you a high-level overview of the work we've been doing for the last several years. And then I'd like to speak briefly and specifically to sections of the bill that we would be most excited about because we feel that they help to advance the profession. So I'm going to share my screen.
Yes.
Just move this. So as we know, I think I missed one, but yeah. This is slide. Yep, I'm good. So we've known for quite some time that the early childhood education system, the system isn't working. And as NAEYC was beginning their Power to the Profession work and beginning to work on the unifying framework, some of us in Vermont were paying close attention. You've seen, let's see, here we go. The audacious vision, although we've seen lots of vision language over the years, this really captured the imagination and the whole scope of where we want to see the system moving. And this slide here is going to kind of outline for you the work that we've done over the last number of years. And so if you look to the bottom left hand in phase one, the big question we were trying to answer was there even interest among the workforce to move forward as a profession? And as you can imagine, many of them many of us were surprised to understand that early childhood education was not yet a profession. And you can see that 72% of the folks that we reached out to and engaged with, which was a significant number, said, yes, we would like to do the work to advance as a profession. In phase 2, and you can see the years that spanned, the big question was, would the ECE workforce choose to align with the unifying framework? And so at this point, we created the Vermont Task Force. And again, it was a broad cross-section of early childhood educators from around the state. And what that group did was they looked at the unifying framework piece by piece by piece, because the whole thing was way too big to tackle at once, studied it, put together a discussion draft, and we went out to the workforce and said, here's this first piece, here are the recommendations, what do you think? So that has spanned about 3 years or so doing that work. And the answer, which I will share with you in a little more detail in a minute, was that for each of these pieces, there was broad workforce support to move forward in that way. And then the third phase, which is really where we are now, is beginning to work with the early childhood education ecosystem, beginning to answer the question, how would this even work? And so this is the place where all along we have been in dialogue and doing updates for our partners in the ecosystem, including Agency of Education, Child Development Division, Building Bright Futures, Northern Lights, the Early Childhood Higher Ed Consortium. Now we're really needing to start to partner with some of those groups and with cross-sections from the different groups to figure out how pieces of this might look. So the first, just going back to phase 2, I'm going to go through these slides fairly quickly. I want to tell you how they're structured. If you look across the top, you can see the time frame within which we were talking about professional identity. You can see the number of participants who came to sessions and had discussion and conversation about this. And you can also see the surveys that we did and the results for each of them. So there was a high level of agreement among early childhood educators who participated in these to adopt and pursue the professional identity as named in the unifying framework. And since then, it's been really interesting to see this name, early childhood educator, being used much more in communications, in self-descriptions, and including even in the RAND financing study that came out recently. The next section that we looked at, piece that we looked at, there's a whole lot bundled together in here, but these are the 3 designations, early childhood educator 1, 2, and 3, with associated preparation pathways. And so for each one, there's a recommended and approved pathway to reach that designation. They have a specific scope of practice based on their competencies. And then the idea is that compensation and responsibilities also increase. And again, looking down the right-hand side, you can see the levels of support for this. One of the big concerns that came out in this particular consensus cycle was people asking the question of what's going to happen with experienced members of the childcare workforce. Are they going to be left out? Are they going to be pushed out? And so one of the implementation pieces that we're working on right now is a process by which they would have be able to establish equivalence and be able to show their competence so that even if they didn't have the academic credential, they would still qualify. So that's one of the pieces that we're working on right now because we don't want to lose anyone. The next piece was professional compensation. And here it was not so much the dollars and cents that the unifying framework specifically recommended, but looking at what are the principles, what's the foundation for how this professional compensation should be structured. It should be comparable across settings. It should include some kind of a benefits package. It should increase with increased preparation and competency, and it should not be differentiated on the basis of the ages of children. So for example, infant and toddler folks who are working with that age group should be compensated in parity equally with others. So I think, and the implementation work that's been done here, I specifically want to highlight because we had a design team, and I think you may be aware of this, who did some very thoughtful research-based supported work to create a compensation, minimum compensation scale. And so they looked at breaking down average public school teacher wages in the primary grades to come up with an hourly rate, multiplying that out by the hours and days, the calendar that childcare folks work to come up with a true wage parity. They looked at other professions. They did some preliminary work on a benefits package, and they framed it all around the 3 designations. So that's some of the, once we had the, yes, this looks good to us, some of the design work that was completed. And then professional licensure, and here this is an individual professional license as an early childhood educator 1, 2, or 3. This was a piece that the task force studied. We took out to the workforce, and again, you can see the level of support here. And I will just mention again, refer us back to once again, the bridge was a big deal for people, and understandably, how will I make sure that I can get there? And so that work is underway, and we are working on a model for that. In addition, people were identifying supports that they would value in making the transition. And I think that's also something we want to keep an eye on, is the supports to get there and the supports to stay there. So then, if we think about the workforce as the heart of the system, there's the audacious vision again. And in green, if we don't have what's in green, then we don't have the vision that we're aiming towards. And so some connections I would make between the bill and the unifying framework and what we've been hearing from the Vermont workforce. First of all, with professional compensation, the bill talks about tiered professional compensation standard. And yes, and I would say that meshes with the concept of an early childhood educator 1, 2, and 3 designation. Secondly, comparable compensation. And again, we talked about true wage parity, including benefits. Again, that's very compatible with where the workforce is saying they want to go. I noted in the bill the idea of it being adjusted over time for inflation and for when public school wages begin to change because of renegotiated agreements. That seems like a real strength. And also the requirement that programs receiving subsidy pay their staff according to these standards. The one recommendation I would make here is for Vermont AEYC to be a partner with CDD and BBF to build on the work that they've already done. I think that there's a capacity to really inform that work, bring some things to the table, and not start with a blank piece of paper. The next slide. And I'm pretty close to finished. I know we're a little time crunchy. The workforce supports are also very exciting in this bill. The notion of a temporary childcare worker retention bonus, which addresses some immediate need while a structure for a long-term change in the system is being designed. That's important. Also, increased funding for TEACH, which supports entry into and growth in the profession. So these ongoing workforce supports are very important as well. And then I just add 2 recommendations here, and I think this echoes some of what Lauren was talking about from the national level, is we want to keep an eye on the preparation programs. These are essential partners and they are vulnerable. We also want to be thinking, as we're making these short-term improvements, how can we set our long-term trajectory to where we want to be? And then the last piece, this is another thing we're working on now and is coming up, is we are eagerly anticipating model legislation from the Commission, which is, and it was entitled the Early Childhood Educational Professional Recognition Act. That's an opportunity to study and discuss some potential legislation that would establish the profession. We're also in conversation recently begun and will continue with the Office for Professional Regulation to understand what that process is. And really what we're aiming for with this notion of a recognized early childhood education profession is that people will be inspired by it, drawn to it. So the whole recruitment piece, that they'll be prepared for and continually building their expertise for this work. Again, there's the quality piece, and that they'll be able to survive and thrive in this as a sustainable and rewarding lifelong career, which speaks to retention and the need to build up and support this workforce. So those are the things that I intended to share with you today. I'm happy to answer any questions if you have them. And I'll take the screen down so we can see each other better.
Thank you. You know, as you've gone through this, I think you've indicated elements of your written testimony where you might bring recommendations, for example, on the pay scale. I think you've talked about that and some of the bridge information. So I'm going to open it up for questions, and I think we have your written testimony. But beyond that, if you do have specific recommendations, we would welcome receiving those. So just to say, all right, were you expecting to go through all the other written testimony that you sent us? Okay.
No, but that written
That's what it looked like.
it goes with the PowerPoint. So you've really heard the full content of what I was hoping to share with you today.
Right, and you put it in the context of the bill, and that's really helpful. Yeah, thank you. Questions? Senator Weeks.
I'm trying to equate EC 123 into S56, and maybe I'm not familiar enough with the bill, but I do remember team leaders and then associates having education requirements, but I don't remember seeing ECE 123. And I'm just wondering if did I miss something, or how do we translate?
The language I saw in the bill was about a tiered compensation system. And if we think about the RAND financing study, in that particular study, if you take a look, you can see a chart where they built in those ECE 1, 2, and 3. And the scope of practice for an ECE 1 would be a CDA, which is a national level certificate, which would qualify them to be in a support role. For an early childhood educator 2, it would be an associate's degree in early childhood education, and that would qualify them to be a lead role. And for ECE 3, it's a bachelor's degree, and that would qualify them not only to be in a lead role, but to be guiding the practice of early childhood educator 2 and 1. And so you can see, just thinking about the preparation pathways for those, why some of the current workforce folks might be saying, yikes, am I going to be able to move into this profession? Which is why we really need to have another way to demonstrate competency in the transition, because we know that there are very skilled folks working with young children who may not currently have those particular academic credentials. Does that help to answer your question?
It does. Thank you very much.
Susan, thank you for your presentation. Can we go back to the survey for a minute? I noticed that, do we know the number of EC professionals that we're talking about in Vermont? Because only 58% of them responded. I'm just wondering if there was how many people got sent the survey and how many actually responded?
Do you want to see those screens again?
Oh, if you have the numbers, I'm just wondering how many people are talking about.
Sure. Let me just, I have the slides in paper form here. So I don't know that we have good data on exactly how many folks are in the childcare workforce right now. I think that's been a big question, is the data. I do know that when we did professional identity, which was the first one, we had 357 participants and we had a 40% return on surveys. As we went along, we had growing numbers and higher returns on surveys. So for example, the 3 designations, we had 318 participants, 203 surveys. And one of the things I did with the surveys in analyzing was I broke them down by subgroups to see if were we hearing something different from center-based folks than we were hearing from family childcare. And there were not significant differences. And I also watched, so as more surveys came in, were we seeing different kinds of responses? And so it didn't seem like the more surveys we were just getting more of the same breakdowns. So, I also worked with someone who has even more expertise in surveying than I do, just to make sure that we were asking the right questions and analyzing it the right way. So I feel like we have credible data.
Okay, thank
Does
you.
that help?
Good job.
You know, that's really helpful. I mean, because having that information from people, boots on the ground, work in the workforce is important to us here. We can't invite everyone in to testify.
Right. The last thing I would add is we're currently running a pledge to see how many people in the workforce would say, I'm in, this is a direction I want to go in. We set a goal of 1,000 pledges this year. Since October, we have over 500. And that's growing as we go along. So, you know, we really want to be able to accurately portray what the consensus broadly among the workforce might be, even though there are some folks who might not be in full support. We feel like we're hearing tremendous support.
Thank you. Any other questions? Thank you for your time and your commitment.
Thank you very much. It was a pleasure to speak to you today.
Thank you. We're going to move along, and we have with us Deputy Commissioner Miranda Gray from CDD, and we have Dr. Heather Shea from Deputy Secretary of AOE. How do you want it? Are you going together or separately?
Sure.
Go together. Terrific. And before we start, I don't think that. Yeah, so. I think we'll go around and introduce ourselves one more time because we haven't had. Start with Senator Gould.
Hi, Senator Gulick. You know me from Senate
Well, you already know everyone. It's not fair.
I haven't seen you.
I know, I haven't seen you in a while. This is good. So I think we're good then, are we?
I think so.
So, and just one thing I want to say before we start is thank you for your work on S197 last year, which was for me a really, really, really important bill on helping kids and teachers, your idea for teachers, with mental health issues and sending those grants out. And at some point, I think I'm going to invite you in just to talk about how that bill is going, and also folks from DMH.
Guess what I was doing right before?
That's
looking at
terrific.
bids.
Right. Okay, that's good.
The grants are done. It's the contract.
The down part for me was that the governor didn't sign the bill, and that was really, for me, it was a real, really unfortunate. So we'll talk about that sometime. But only because we asked the executive branch to bring us a report for an executive branch activity. But c'est la vie, you know, but I'm so glad that the work is going forward, and well, I will get you on the schedule.
I would love that.
That would be awesome. Thank you. All right, so welcome. You can introduce yourselves for the record, and we welcome the testimony.
I am Heather Boucher, Deputy Secretary for the Agency of Education. Happy to be here.
And I'm Miranda Gray. I'm the Deputy Commissioner actually of the Economic Services Division as of last week. However, I will be continuing to support the Child Protection Division through the transition for the next few weeks or as needed during the legislative session. So on behalf of the agencies of Human Services and Education, we'd like to thank the committee for your attention to the critical issue of childcare and early childhood education. Today, we share the administration's thoughts on S56, as well as ask clarifying questions to better understand the intent behind specific sections of the bill. We are pleased about and will highlight sections where the administration and the legislature have areas of clear alignment. As you know, the governor has proposed increasing the child care financial assistance program to 400% of the federal poverty level. While slightly below the level the committee seeks in Act 56, It would clearly be a building block. The administration also asked for funding to increase the capacity of the community child care support agencies that both provide parents and caregivers with support finding childcare, as well as process eligibility to determine if a family is eligible for childcare financial assistance. We are also seeking funds to support school age youth in accessing childcare financial assistance. Through our current capacity building efforts that target existing programs and adding spaces, we believe that we could support upwards of an additional 5,000 school age families affording care. S56 does not contemplate creating equity in payments for families, yet we believe there is agreement that what a family receives for financial support to pay for care should not be dependent upon where one lives in the state or what programs are accessible to them. For $4.9 million, Vermont would be able to pay a child care provider on behalf of a family the 5-star rate, which would help programs offset the increasing cost of inflation or increase wages for staff. Separating CCFAP payments and stars does not remove all the incentives for providers to provide high quality care. There are still both financial incentives. To be a universal pre-kindergarten provider, one must have 4 or 5 stars, and the specialized childcare program must have 3 or more stars to receive a 20% increase. There are also supports for programs in achieving the high quality care we all want our youngest Vermonters. We want for our youngest Vermonters. Lastly, we have asked for a total of 6 positions to support the increased caseload these changes would bring about. The Child Development Division has strived to meet the needs of families, children, and partners, and these positions would help continue our efforts. Making the $56 million investment could be a great first step. Today, we'll provide our thoughts section for the sections that the Office of Legislative Counsel had outlined previously. And now I will turn it over to the Deputy Secretary.
So I'm going to jump in quickly. I understand there's now a placeholder for the pre-K component to the bill.
That's right.
And so I believe, Madam Chair, you wanted me to at least touch on some of the
Yes,
our
please.
feedback.
You know, I think it's helpful for us in our capacity in here, but it is extremely helpful, as you know, down the hallway. So, great.
And we look forward to testifying.
Yeah.
Hopefully being invited for that as well. So at first, we would like to start with a positive that we really love the idea of expanding pre-K entitlement hours to a more universal system. We'd certainly be open to exploring that further as this legislation develops. As you heard from, I believe, many witnesses last week, stakeholders do have concerns about the perhaps unintentional impact of us moving away from a mixed delivery system for pre-K. I understand that this conversation today is about the whole of early childcare in this legislation, but I'm going to focus specifically, which is my job, on pre-K.
Right.
So at the risk of reiterating this theme about the importance of the mixed delivery model, it does feel important to highlight that last year, a little bit before this time last year, there was a federal law, Build Back Better, that we thought was actually going to go into enactment at the federal level. So we started to do a lot of work. And it turned out that national politics, congressional politics perhaps got in the way, and it wasn't delivered. But it's important, I think, to note that that model really focused on a mixed delivery system. So both public and either nonprofit or private providers of services. And it's important, I think, for us to keep that in mind in terms of future funding for federal dollars. Then in late December, Vermont, we were again successful in receiving another preschool development grant, which you might hear about as PDG. And this proposed plan at the time was, and how we got funded, was built upon both public and private programs serving 3 to 5-year-old children. Our understanding is that was, again, a core piece of why we got the funding, because it fits with that federal model of what they're attempting to do. So a centerpiece of this work that I think is important for the committee to hear about is establishing and more fully establishing and expanding what is called an early MTSS system. And the idea is to have early MTSS, which stands for multi-tiered systems of support for all pre-K students, regardless of the context they're in. And so this is the method by which you actually bring to bear in the public sphere or in the private sphere, all of the different services and supports and coordinate them for our youngest kiddos. So K-12 MTSS is about academics, it's about social emotional learning, it's about mental wellness. We want to establish that same kind of a system for all of our pre-K students in the state. And again, we've contemplated that based on the current system. So that's important, I think, for us to know. It's a little unclear to us at this time if we move forward with universal just in the public sphere and just for 4-year-olds as it's currently written, or placeholder, the last I knew was currently written, what that would mean for this grant. And we would just want to be transparent about that, and we're happy to talk further about
Yeah,
that.
thank you. Thank you for that. That's actually new information for us. Helpful.
Then I want to just frame the rest of my testimony around, and it'll be very brief, around a few questions that arise. Again, we want to really acknowledge the work of the General Assembly. It's exciting. I think we all are on the same page, as Miranda pointed out, around several aspects of really ensuring that our youngest kids can get the education and social supports they need. But with the current proposal, as I saw it, there were a few questions that I just wanted to leave with the committee to sort of chew on. So the first is, if we're framing this change around what is best for kids, which is the way we always operate in terms of the agency of education, doesn't have to be everyone's frame, but that's our frame. Has the committee considered the developmental impact of, in effect, removing 3-year-olds from the pre-K space, or at least the publicly funded pre-K space? Research documents, including, this goes back many years, my own master's thesis was on Vygotsky theory, which actually, the hallmark of that is that both older and younger kids have extensive benefits when they get to interact with each other, and when they get to play and learn and socialize with each other. And so I believe that what that means is we need to think carefully about what that would mean, both for 3-year-olds potentially not getting access to 4-year-olds where they can actually stretch up and learn a little bit more, and then also for 4-year-olds who would not have the opportunity necessarily that they do now to really stretch down and be almost in that big peer really role. And so I think that, again, that's just something we want to think about. There are developmental implications of that, and we just want to be sure that we thought that through. And then one of the things that I think we're still trying to understand is, from our perspective, I think the administration's perspective, and I think for many folks, perhaps around this table too, the critical shortage for the early years seems to be infancy and toddlerhood. And so it's a little unclear to us how UPK is necessarily going to fix that. And so we want to have some more discussion or contemplation about what that looks like. For instance, I think we would all need to kind of check, if we're thinking it's just going to be a switch, and so the dollars and the people would just kind of switch, I think that's a little short-sighted. A lot of folks are interested in typically birth to toddlerhood. That's sort of like their passion, their goal, and thinking that they would, they wouldn't automatically be interested in doing pre-K and vice versa. So I think we just need to think about that a little bit more in terms of, again, the impact on the full system. One of the things that we are interested in is whether there are additional concepts to explore to achieve universal. For instance, we still have this 10-hour-a-week construct, and has the General Assembly contemplated what would it look like? How could we actually have a more full-time UPK, at least moving towards a more full-time UPK for all students?
Are you thinking of expanded eligibility?
Well, I'm thinking of expanded, yes, because
Yeah.
the hours right now pay for $10,
Right.
or $10.
$10.
10 hours. So we'd be happy to think about and explore some of those ideas
Well,
more.
would be
How would we get to 30
We brought
hours?
that up in
Yeah.
committee, and so it would be helpful to know what the cost analysis might look like.
We'd be happy to come back.
Terrific.
To come back with that, from my understanding. Yes. Yep. And that is something the governor would really be excited about.
Oh, good.
Yes. Expansion of hours.
That's good.
There are several interdependencies regarding pre-K in the regular school system that will benefit, we think, from further consideration. So what will be the programmatic and fiscal impact of additional busing, expansion of school breakfast and lunch? I'm not talking about universal meals because I know that's another thing, but if that doesn't go through, we are going to have an expansion of lunch potentially and breakfast for public pre-K students. And I think very important for families, and here I don't have my student hat on, but expanded after school and summer programming and what those transitions look like, because the school day has to have something after, just like it does for many school-age children. There needs to be something, for most parents, they're not done at 3 o'clock. And so we have to find some other kind of care, particularly for most of our working parents. And then what would that look like for 4-year-olds? What would these types of programs and services look like for 4-year-olds? And again, we're just raising these as points to consider or think about, and we're happy to kind of keep talking with the General Assembly about these. And then finally, something that I haven't heard mentioned, and I did want to point out, we actually have in the state some current really awesome public pre-K programs that actually already serve 3-year-olds. They serve 3 and 4-year-olds. And so I'm thinking of North Country, I'm thinking of Barry. They have some really excellent public programs that have already moved to what we might consider kind of a universal system at the district. And they serve the younger kids. They serve 3 and 4-year-olds. And so we want to actually, would the way the bill is currently contemplated, would they have to back out services for 3-year-olds? That would obviously be probably catastrophic for some of those families in those regions. So something to think about. We're very good in education about noting where the one size doesn't fit all. And we're very good in Vermont about, at that local level, because that's the way we're set up, really having a lot of innovation and really cool things happening. And I think this is one of those cases where they've gone ahead at that local level. Not surprisingly, those are 2 of our more needy regions as well.
We didn't know about that.
Yeah.
It's good news.
There's probably more too. Those are the 2 I did.
Okay.
This may be a no one question, but I have a couple different programs in my town. And one of them's the 10-hour part-time, 3 days a week. And I asked him about S56, take a look at it, tell me what you think. He came back with, that doesn't affect us because that's a federal funding for the part-time program. So I don't want to mix apples and oranges either, but can we do both?
I have to learn more about what meaning both. I mean, I think the funding construct is complex, and I think Miranda's going to get into that more. And part of it is about families and what they qualify for. So I think that's part of what you're getting at. The other complexity is I am just talking about pre-K. So if this were a pre-K program,
It is.
okay, because sometimes we mix that up and talk about infancy all the way to pre-K. So I'd want to hear more about it, possibly.
Are we? I don't know if she's finished it.
Well, are you done, Heather?
I'm done, I believe,
Okay.
yes.
Oh, okay.
Heather's
Now
done.
you can.
Sorry. It might be a Head Start program if it's fully federally funded, maybe that's what. Well, first of all, thank you for running through some questions and being willing to think through expansion of UPK. I think that was the intent of putting that section of the bill on the table, was to say, we need to have this conversation about how we can expand beyond 10 hours and how we can do it in a way that includes the public schools. And I know that's your bailiwick. I also thank you for mentioning the programs that already exist in my district. And you probably know Middlebury has an excellent.
I didn't know, so that's what I
that
said.
are
I'm sure
elementary.
others. I didn't know
Yeah.
about these 2.
Yeah, I mean, there's an excellent pre-K program. It's partly their triple E, but it's beyond that. And it's in our public schools, and it has been for years. And I was talking to Senator Clarkson, there's one in her, they're all over the state. So, I think how can we build on those? Because often public schools are the only thing in a community also. There's not a well, integrated system. And so having a broader discussion about how we can expand on what's working and how we can include 3-year-olds, 4-year-olds, it was just here's a way to expand and to include all 4-year-olds, but because I think ideally going to full-time is what we really need. And one thing that I'm sure note, but I think a lot of people have missed in the bill is the school finance implications that include a 1.0 weight for early childhood education, which is crucial if we're going to actually fund it. So building off of those concepts, I think are really important. And I know the chair doesn't want us to have a broader conversation in this room about it, but I appreciate you wanting to have that conversation. There are obviously things that we need to consider and, implications beyond, but I think it's really important in the broader discussion that we really think about how to expand to actually have real universal pre-K that's supported in our schools and in community-based providers, if we can figure out an appropriate funding mechanism.
I think that's great. I mean, I just focused on the way the bill had been currently written. So I think just the idea that like this was the first pass, if I'm hearing you correctly, is great.
So, and I would like to correct, I do want to have a full conversation, but the full conversation for pre-K actually belongs in education, and the linkage with us will continue to do that. And your testimony is extremely helpful and appreciate it, particularly with regard to the mixed delivery system and the grants programs that are ongoing. We don't want to step into the middle of that. And the other, what I haven't heard is any thinking about a timeline for moving forward on pre-K. And obviously that's not the conversation that we're going to take and we're going to have in here, but it is something I hope that the education committee will be looking at. And what's the timeline for the universal pre-K and how does it fit with what we currently have? In here, I think we'd love to see the extension of eligibility. So that's good. Oh, so Miranda has it. Okay.
Wait, can I ask Heather another question? You didn't comment at all about the structure within the department and the.
Yeah, we're still thinking about that. And we certainly recognize and appreciate the why of trying to actually equate two pretty different structure, two departments that are quite differentially structured. The way it's currently written, and I have heard that it kind of was, I hope this resonates with you, that kind of was like an initial suggestion and then continued talks to have about that.
Well, I mean, every bill kind of is, right?
Sure.
But I think there was a lot of conversation about how can we make the two agencies, how can we lift up early childhood education in the two existing agencies without creating a whole new unit? Because that in and of itself seemed really problematic. And
there's a couple things I would just add to that. So one is the special education piece just kind of got thrown in, and that's a much broader
huge
purview in the agency. And so we wanted, I'm happy to come back and talk more in depth about that kind of piece of it. The other thing is we certainly agree with wanting to elevate early. But right now this could actually get into, you probably need to talk to our DHR commissioner, because right now there is a classified position that is what was actually discussed as now moving to an exempt position. And so there are a lot of intricate details that would need to be worked out.
Right, the reason special ed was because you already have a division director, which is what you're talking about, that position. It was basically looking at that division director position and saying, let's elevate that position to give early childhood and frankly MTSS and special education more visibility and more weight in the department. So it was intentional to lift it up and keep I mean, you already have it structured that those three are together. So it wasn't a new idea. It was the way it already was. It's just lifting it to a.
Right, but can I just add one
Yeah,
piece?
please.
So, I think that there would be challenges with setting a precedent that, in effect, the General Assembly would be identifying the person for a particular job that, like,
Oh,
like-
that wasn't the intent.
but
It
that's
was-
what would happen.
I
So,
see.
so that's what I'm trying to say, like this, there would be potentially, and again, I would call on Commissioner Prestigi, because it is a classified role currently, to actually, with a grand swoop, make it exempt, would have bargaining contract implications. So that's kind of what I'm trying to get at.
Oh, I
is
see what you mean. It wasn't
Um,
supposed to be tied to an actual individual person. It wasn't really like we said we want.
But because it is.
I hear you on that. That was,
Yeah,
I don't even know who holds that position frankly, so that wasn't the intent.
Yeah, and again, like we recognize that, and but you know, it's when you get into these nitty gritty details, it's like, well, that's why I'm saying, like, we're still thinking about this,
Fair.
and committed to actually working with the General Assembly to figure this out, because we agree that we want early childhood to have a very important place in state government.
And in your
in our
testimony, you actually mentioned the connection with early childhood MTSS, and in the testimony you just gave.
But that's different than special ed, but yes.
It might be different than special ed, but the connection with MTSS, and I think there's a lot of connections with early childhood, special ed, and early intervention. And
There certainly is,
all of
but
that.
it's not the only connection, and so.
Yeah.
So this is good. I mean, it will be helpful too, I think, as you're moving your testimony into education and carrying some of the thoughts from the original introduction of the bill. Obviously, it's going to be, it will change, there's no question. And so Miranda, you are here and we're very pleased that you're here. And wait, can you tell us what position you're moving to?
Yeah, of course. The Deputy Commissioner for the Economic Services Division.
We're not losing you.
You are not losing me. I'll just have slightly different topic areas that I'll be focusing on.
Okay. So why don't you introduce yourself formally and then we'll.
Absolutely. Thank you. Thank you. So Miranda Gray, Deputy Commissioner for the Economic Services Division for today. And so I'm going to pick up where Heather had left off. And so it's sections 12 through 14, which are the property tax exemptions. So the administration supports this section of the bill and applauds the creative way to address one of the expenses faced by childcare programs. In fact, the governor has proposed a more generous construct before. 2 years ago, we proposed a full property tax exemption for pre-K providers and a $40,000 property value exemption for all other licensed and registered childcare providers, totaling to a non-homestead education property tax reduction of $830,000. I'm just gonna quickly glance up, and if not, then I'll move to the next section.
So, thank you. Okay. So do we have those numbers? Yes. Okay, we're good. I lost my place.
No problem. So sections 15 through 68, which is the Department for Children and Families restructure and the creation of the Department of Economic Empowerment. While the Department for Children and Families is large, we've tried operating in separate divisions before. The ability to coordinate and collaborate around families that seek support from the Economic Services Division, the Office of Child Support, and the Family Services Division, to name a few, can quickly become complicated when not overseen by a single department. There are also fiscal implications of needing to create new offices for overhead and positions that are shared amongst the 3 divisions and 3 offices that currently reside within the Department of Children and Families, including Commissioner's Office staff, a single business office, human resources, and legal staff. The administration does not support moving the Maternal Child Health Office out of the Vermont Department of Health, when Maternal Child and Health has been a strong collaborator with both the Child Development Division and the Agency of Education, and being connected to a larger department proved to be highly valuable during the pandemic, as they were a link and voice for all children in Vermont.
So to ask a question here, you heard the previous discussion with Dr. Boucher, and I'm wondering, how do we get that leadership position in place if, some of the consolidation isn't in place? Is there a way to do that? Are there recommendations? And
I think we are also still trying to be very thoughtful about what would that look like, understanding where we have been in the past, of where we have been separate entities, and now under one department. But I don't come to you today with a solution, but I think an openness to having conversation, to see, what you might be thinking.
we'll do that. I think this is a real conundrum, I think, overall, and it has been that way for a while. And whether we can get to finishing the discussion and getting something solid is, I find it, it'll be great if we can do that. Try. Senator Hardy has a question, and then Senator Gulick has a question.
Well, I was similar to what Senator Lyons, it doesn't seem like you're taking a position on, I hear you on the child and maternal health, you're clear on that, but the rest of it, it's vague. And when do you think you might be done with your thinking on it? Well, just because we have a deadline, and I think to follow up what Senator Lyons said, this has been an issue for years with DCF just being overwhelmed with all of the stuff that's in their basket and trying to, divide up and make two new department, one new department and one sort of refreshed department would benefit CDD, but it would also benefit all the other entities that are in these two departments by having people have more time to focus on the important work that they all do. And I know you're under instructions about what you can tell us, but we are under a deadline about trying to figure this out. And we did try to work with you guys on the off session multiple times and didn't.
So not going backwards, but just going forwards, is there something you could bring us that would help us move forward on this? I think the bill also has a ways to go, but we want to move the bill maybe as early as next week. So that's where we are.
Understood. And so I'm happy to follow back up. I think there's, as you see the benefits, I think we also can see where there's challenges with moving different offices and divisions into two separate entities that we have. Well, and I can't say I have not lived under like the previous or have not worked under that previous, but we have a lot of people who have. And so it is collectively trying to understand what benefits were gained by going into one department.
Let me ask this question and then I'll go to Senator Gulick, but should there be a restructuring in the bill that you would have to follow at this point, along with changes to CCFAP and other financial pieces that are in the bill and licensing pieces that might be in the bill, or requiring, the credentialing and so on. But can all of those things be done if our goal is to have some of these things done by 2024, especially the CCFAP? Can all of that happen together? The restructuring, the CCFAP.
I don't want to speak out of turn, but I might be right now, but I believe that is a lot. I just think that there's other places in the bill that you'll see I get very specific in some sections of like what this lift means for the child development division alone, outside of talking about potential larger restructure. So
That's good. All right, thank you.
I was just hoping you could lay out a little more clearly what the conundrum is that you're referring to for us new folks. It's obviously around restructuring with DCF license.
Well, in the bill, there's governance structure, both related to education as well as to DCF and the agency as a whole. So That's what we're.
But it seems like there's a conundrum that has a history that we may not.
Oh, the conundrum with the history is it's always been split between two different agencies, and there hasn't always been a close connection between the two agencies. So I think we're starting to see some of that resolved. We also have questions here in the legislature about the staffing and the resources needed to accomplish all the goals for childcare and for early education. So there's a lot embedded in there. And then if you add on restructuring at the same time, you're moving forward with some of the financial work. I mean, it is complicated. So that's all we're talking about there. Question.
I just want to add that, so there are, I think, two conundrums that are related, but one is the dual oversight of early childhood education, which was identified very, very strongly in the systems analysis last year as a problem. And that early childhood educators in the field and parents and programs have a really hard time with the dual oversight of two agencies. And so the bill actually gets rid of the dual oversight and just says AOE is responsible for programs in schools, DCF is responsible for programs in private providers, more or less. I mean, that's an oversimplification, but that's more or less what it is. And so that is one conundrum I think that the chair is referring to. The second is that traditionally DCF, because there's so much that department has to oversee, so many really challenging programs and issues and problems to solve, that they have been and this is just an outside observation, and Deputy Director Miranda Gray can speak to it more, but they've just been overwhelmed with all the work they have to do. And so part of the bill's intent is to sort of divide up that department so that it would have a clearer focus. One would be on sort of economic services and one would be on programs, and mainly focusing actually on children's and families, which is what the department is called.
And then underlying that is, regardless of what you do to restructure, is there sufficient staff and are there sufficient resources to accomplish the goals? So that's been an ongoing issue, and I'm not going to ask you that question. Your answer. So, and we have been talking about childcare and appropriations also. And I may ask a question about that as we go forward about some of our questions. But Miranda, you want to finish up? Please go ahead.
Yes, thank you. So sections 69 through 80 are the childcare and childcare subsidy sections. As I mentioned previously, the administration supports increasing the federal poverty level. Within the current implementation of childcare financial assistance, almost all families up to 300% of the federal poverty level pay 10% or less of their income on childcare. This is caveated with this calculation is based upon the childcare rates set by the state and the subsidy amount paid on behalf of families to the childcare programs. Programs might charge families above the subsidy rates, and that data is not collected by the state. So therefore, that's not representative in our estimates. Areas that we find concerning are removing the service needs as outlined on page 96. Sorry, I see sorry, I'll keep going. I was like, oh, we didn't space that. So I'm going to go into some of the areas of concern and then give you what, I apologize, I think they're what pages and what
Previous
lines.
draft, that's okay. We'll get the sections.
Okay,
Yeah.
perfect. So on page 96, lines 5 through 10, and I believe I've mentioned this to the committee in a previous testimony, service needs are part of federal regulations. We would not want to create an inequitable program where families with higher income were held to different standards than families with lower incomes. The administration suggests looking at who is not being supported and how we can include them within the service needs that already focus on a parent or caregiver looking for work, obtaining training or education. So then previously on page 96, line 17, this contemplates moving the $0 family share from 150% to 185% of the federal poverty level. And I just want to note that this has fiscal implications, as the state would be responsible for more of the payment to providers. This would shift the family share to the state picking up that expense. Page 97, lines 15 through 17. While the Child Development Division hopes to one day have an online application, this is not currently in the build for our Module 1 of our new information technology system that we're building right now. This will take time to complete. So I just wanted to, it is something that we want to have as well. I just caution that it might take us a little bit of time. Page 99, lines 1 through 12. We do not understand the construct for the changing the wages. Childcare programs are private companies and organizations. To set wage floors or benefit floors in rule is not a good use of rule and sets DC up for failure, and that will also drive our budget. We cannot do both CCFAP rates and these wages that will not garner the outcome the legislature is seeking. Are there other options the legislature has for raising provider wages? Is there an estimate of how much CCFAP would have to increase to cover the estimated increase in wages and benefits? Page 100, line 2. The Child Development Division is working on enrollment versus attendance report that is due on March 30th. So I know this is something that is being contemplated in S56, and we do have a report that is due to this committee and others.
So it's gonna just cross over.
It is.
After crossover. Yeah, we get that.
Page 100, lines 7 through 20. Federally, the Child Development Division must complete a market rate survey, or Vermont must come up with, present, and have an approved alternate methodology to set rates. So this is federally, we are mandated to do this. Questions we have are, how would the division determine the total cost of care? Would there be limits on expenses? What authority does the division have to tell private providers what can be spent on operating supplies and expenses? How much it pays employees? How could the state feasibly budget for something that has no cap?
Right, so that the total cost of care does add to the total cost.
Yes. Pages 102 to 103. While the department supports a non-citizen child care assistance program, I do want to emphasize that we do support this. Our new IT system is not currently able to handle a change of this magnitude, and to prioritize adding this functionality means delaying building, licensing, and professional development components of our new system, which means that the division will have to maintain residing in 2 IT systems, and the older system is a relic system known as Bright Futures Information System, and truly the Agency of Digital Services has a goal of moving us out of that sooner rather than later.
So, but overall, you're not opposed to the non-assisted child care assistance program. You're supportive of it. I've heard that before. Is there some timeline that you can present us that would put these things in order one way or the other?
I believe that this had contemplated being able to implement this in 2024, if I remember correctly.
Mhm.
And I think what we know is our module 1 of our just being able to do the childcare financial assistance, we are looking at like the end of December of this year. And so that's where the concern comes of trying to change anything means we further delay either components that we haven't gotten built or having to extend out, depending on what the scope of work could look like, we might need to put that out for procurement. Those things all just take time, or include it in our next build, which would also take time. So I guess my answer is I don't have a timeline other than to say I think it would be.
Can you get us something, an idea of what you're currently planning to do, and then what the non-citizen program, where it would fit?
Yes, you can also do that. All right. Page 104, section 76. The state would happily continue working to make the special accommodation grant processes more user-friendly for programs. We have been trying to find a path forward. However, because it is a grant, it must conform to uniform guidance, which although TDS does ensure that taxpayer dollars are being used as authorized. So I know this contemplates, could it make the grants for a year? It all depends on when a program becomes eligible or they request funding. So there's just complications. We continue to try to see what we can do within our confines to make this more accessible for programs so that they can get the support that they need for the children that they're serving.
Is there better language that we can put in the bill that would help move this forward?
Can I come back to you with
Yeah.
that as well? We might have.
Yeah, because what we put in there was really a placeholder. We did not want to lose sight of the special accommodation grants. So it would be helpful for something.
All right. And the last point here is page 104, section 77. The state urges the legislature to find an alternate way to support the early childhood workforce. The current retention bonus grant program, the $7 million that we've been administering, has not only been challenging for providers, it's also been labor intensive for the administration to administer. There's no simple way for us to increase wages for the field because these are private businesses and the state must follow uniform guidance. So I know that that was a grant that's being contemplated. And I just want to be very transparent in that it has been a challenge to get the $7 million out already.
Is there a way to do, well, if it's a grant application, can we build on other grant programs in the early childhood world?
Not that come to mind. I have been thinking about, what exists. I also look to like, is there something else, some other sector that has done increases to wages or a bonus program? But it is really complicated when you have to, and we have heard the feedback loud and clear from childcare programs, that this was labor intensive for the family childcare homes. It was a pretty quick and easy process, but for the center-based programs, this hasn't been an easy process. And we're doing all that we can to support them through it, but it still comes with its challenges.
And it doesn't fit with anything we're doing with the DAs.
No,
No.
I mean, we'll continue to think that if you have ideas, or
We've been stepping outside the box all year, so it might be what it is.
Was there discussion, I thought I heard that there was discussion of using an outside vendor to provide the bonuses, was that?
So they still would have to conform to uniform guidance. So no matter what, like the state becomes responsible for any money that we're putting out. And so that means like we have to be able to ensure that the right people got the right money. And so it just kind of, at this point, that had been contemplated with the $7 million, it was just adding a layer. And then it also is, we would have to go out for procurement to find an entity to do this for us. So that would delay the process. And so at this point, I believe that we aren't doing that for the existing money that we have, because our goal is to just, we've worked through a lot of the kinks, I guess I will say. And at this point, we can support the programs that are still applying, because we get new applications every day. But getting to that process.
You can't do like a flat fee, excuse me, a flat amount out to centers and allow for the center to distribute it.
Correct.
Yes, no, that doesn't work. Okay. Okay, that would be too simple. We don't use that word here. All right. Questions, committee?
The part of your testimony,
Go ahead.
if I may, you were done with your testimony, yeah, okay.
Oh, thank you.
And we have it, and it's really helpful. We'll link it up with the new sections from the new bill. I hope Katie's gonna be able to go briefly through.
The section about the changing the wages, and is it, do you not understand the language that's in the bill, or you don't understand the whole concept?
I think it is more that the state would be being asked to not only set the wages, but also the reimbursement and how that is in conflict. Unless you're saying that I'm maybe.
No, wait, what do you mean by that? Can you say more about that?
So if we are to understand and set based on I want to make sure I'm using the right language, the cost of care.
Mm-hmm.
Right, and so what should that be, including like what would the wages be for folks for private businesses? And then we also determine what are we paying programs.
Mm-hmm.
So those two things would be in conflict with each other.
Mm-hmm.
So defining what is the cost of care, that's one.
Right, that
And
is
it's
one.
different across the board, or could be. And then defining who's getting paid what, which could also be different across the state. So
Yes.
I understand the complexity there.
So would you suggest another entity do the salary scale? And that you determine the cost of care, not you, but the
Right.
DCF?
I think you would need to have a separation. right?
Yeah, I mean, what if Building Bright Futures did the salary scale, for example, or some other entity like that?
I'm not sure that it would probably not be Building Great Futures because there's supposed to be a neutral convener. But if there was another entity who would do that, that would play into what the cost of care would be.
Mhm.
Perhaps, but I do think that is like, we're just looking at, we can't do both.
Yeah, yeah, I mean, I think what you're saying is it's kind of a conflict of interest.
Yeah.
I get that. I totally get that. I hadn't thought of that, but I'm just trying to figure out if we have some other entity do the salary scale and you do the cost of care and payment to providers, then it's separating the two out so that we can still do the salary scale. And I will note that the salary, I mean, yes, I hear you that they're private entities. And I just want to note that this is another reason why more in public schools is easier because those are public entities. But yeah, more pre-K, exactly. And you avoid a lot of these complications with dealing with hundreds and hundreds of small private businesses, but that's just an aside. But the setting the salary scale and saying to providers, you need to meet the salary scale in order to get the CCFAP payments is similar to the concept, and Senator Weeks and I actually had a conversation about this a few weeks ago. It's similar to the concept of saying, like, this is the prevailing wage that you have to pay in order to get state funding. So it would be, you know, requiring these private providers who are receiving public funding from the state to meet a salary scale. And there are lots of models for that.
I understand what you're saying, and I
Yeah.
would just also look at the childcare financial assistance is actually a benefit for the families. So so that's like, and that's what we're paying to programs on behalf of families. It's not necessarily set on what that we say how much you need to.
Yeah, so it's hard. If you put the cost of care in there, it changes the whole dynamic.
It does.
Yeah.
And just like what our role is currently, because we do regulate all of the childcare programs and say, here are the regulations that you must meet, but we don't dictate in any way, shape, or form how much they can spend on supplies, how
Mhm.
much they pay in wages, because they are private businesses and have that ability to do that. And then we just say,
Yeah.
absolutely.
What would happen, is there, just thinking for a minute, and then I think we probably should move on and look through the bill, the draft, but is there language we can put in there that would ask of you a definition of cost of care, working with others, so that we could at least have an understanding of what the effect would be on various centers? That makes sense. Who does that? I mean, the centers do that, because the centers would send.
The problem.
No, it won't solve the problem, but it'll take us a step forward in understanding what the total cost is. So anyway, I'll leave that out there, but it is something that is of concern as we go through the bill, because it is complicated. Definitely complicated. Okay. All right. Thank you both. This has been extremely helpful. Today has been very helpful, I think, for all of us on all fronts. And our work is just beginning. And your work is just beginning in education. We will we'll phone a friend again, so thank you. And just FYI, especially for you, Miranda, that as we go through the bill, and I also see that Katerina is here, but as we go through the bill, it will be very important to have you accessible in the room as we go through markup. And because we'll get to the point of having conversation and trying to sort out what we can do and what we can't do, and having your input will be helpful. And I understand that there are certain lines above and beyond and below which you will not go in terms of the budget, but there are some little few options in here. So, okay, thank you.
Thank you.
That's great. And Katie. I feel like we're in the middle of a team process. We get more and more team members. How are you?
I'm well. How are
Good
you?
to see you.
Thank you.
Very well.
Katie McLean, Office of Legislative Counsel, for the record. Do you want me to pull it up on the screen?
Yeah, we have now a hard copy, which is great.
Okay. So I'm joining by Zoom. I think, oh, there we go. Put it on the link.
It's only 85 pages long.
I don't know if there are many other contexts where we're saying just 85 pages. That's a
Yeah, so
downside.
the rewrite of chapter 117 and title 24,
Oh,
when I did that, it was like,
excuse me.
Okay.
That's better. Okay. We should be in business. So good morning, Katie McLean, Office of Legislative Counsel. And you have an amendment 1.1 in front of you. It's a strike all amendment. In terms of substantive changes, this is more, the idea of this is the document to use moving forward as the committee decides to start marking up the bill. There are not many substantive changes. The big substantive change is that all of the pre-K language has been taken out of this amendment, and instead there is a placeholder in section 1 that's entitled, there we go, that's entitled pre-kindergarten. And I believe the idea is that the Senate Education Committee is going to work on this topic, and this is possibly where that language will live. So that is why we're having a placeholder for that
yeah, we
particular
absolutely need that.
section. Oops. And otherwise, if you remember when we first met and discussed the bill, I had sort of an outline, and I told you there are different like large parts of the bill that were organized topically. So those parts are all still here. The only difference is that I've sort of flipped the bill so all of the childcare language appears first. And so you're seeing the childcare sections first, then the tax credit piece, and then the language about dividing the governance division of TCF into 2 departments is all still here. It's just organized differently. Other than that, this doesn't represent substantive changes. This is more of a vehicle to use moving forward.
I'd give us like a 20, 30,000 foot, just to show us where things are.
Yep.
And then what I think we'll do, Nolan's in the room, but I think we'll go a little bit slower through the CCFET places where there are actual numbers, and then we might be able to talk with Nolan a little bit as we do that. We only have 15 minutes.
Okay.
Nolan, maybe it's best if we hold off on that and, yeah.
I mean, one thing I can do at some point is just not give you numbers, but flag where there's costs in the bill.
Yes, let's do that. But can I, when we hit the cost, you can just say cost.
All of ding.
Okay, that's good. We'll get her a little long. That would be great. And so why don't we do that? We'll go the 20,000, 30,000 foot level.
Okay, I'll just cover maybe the childcare pieces
Yeah.
right now.
Great.
So sections 2 and 3 both amend the same section of law, the CCFEP language. These 2 sections take effect on different dates, which is why they're repeated twice. So we have section 2 taking effect July 1, 2023, and section 3 taking effect July 1, 2024.
Big.
I meant to be a joke, sorry.
There are, as Nolan is pointing out, there are different financial implications of each section. So for example, in subdivision A2 of section 2, this is where we have the eligibility framework of who qualifies for a CCFAP benefit. Right now, under existing law, a family has no copay if they're at or below 150% of FPL. This increases that to 185% of FPL. And under existing law, there's a sliding scale of benefits up to families that are at or below 350% of FPL. This would increase that to 425% of FPL in this year, this coming fiscal year. Whereas when we get to section 3, again, same section is being amended, but the effective date is different. And you'll see on line 19 that the 425 is struck and 450 is added. So that assumes that section 2 is adopted and that 425 is in effect, and that you're taking another step up in the coming fiscal year in terms of eligibility.
And the thing that's not mentioned in here is cliff, where the support ends for families, and then people beyond that income eligibility have all of a sudden hit an increased cost. So we have heard from folks about having some kind of a slope that would provide relief as income levels increase. So just I wanted to identify the slope issue.
There's a slope issue. So right now, I mean, let me go back to what the existing law is, 150 to 350. So right now, existing law, families are between 150 FPL, 350 FPL. They're on a slope. So by increasing to 425, you're increasing the size of the slope, if you will. More families are pulled into CCFAP and you're extending the slope.
I'm actually talking about the cliff on
And
the other
then,
side.
so I understand, but
Yeah.
you're just moving the cliff out.
Right.
Yeah.
And then how, is there a way to put a slope down? That's the question. So there's a slope up, is there a slope down? So when Sisyphus gets to the top, or does he keep going?
I will defer all those questions to Nolan.
Okay. That's a Nolan question.
Well, so in terms of
Slope and cliff.
when I look at it,
Okay.
Okay.
Yeah. Oh, go ahead.
So back on that paragraph 2 at the top of page 2, just curious if there's other precedent for lagging the federal poverty guideline index to decrease from 1 year to.
Oh, that's this.
Right, no, I get,
Yeah.
fully understand.
And if
what
it
I'm saying.
goes down,
If it goes down, it says it maintains it for the given year, probably until the next year. It's evaluated again. Why de-link for a year?
Effect of that, well,
who wants to answer that?
the effect of that is it would provide more stability in the benefits for families instead of,
I get that too, but it's so precedent.
so precedent, I would have to look to see if we have it elsewhere in statute. I mean, it's an existing law now.
That's precedent.
What?
That's precedent.
Yeah.
Yeah, this is
That's gonna
current.
change
This is
it.
current
Okay.
statute.
Yeah.
Oh, that's, I didn't get your question. Okay. Okay, now we're back up.
Okay, so
3,000,
we're still, let me see, we're still in section 3, which takes effect January, I keep saying that, July 1, 2024. This is this edition of subdivision 6A is the requirement where the department, in consultation with Building Bright Futures, adopts a tiered professional compensation standard for employees and childcare providers that's comparable to what's happening in public school systems. And they're annually amending rules to set this compensation standard. And then we have in subdivision 6B that in order to participate in CCFAP, the childcare provider would have to use this professional compensation standard to compensate the program's employees. So that's a July 1, 2025 proposal. Then we get into, do you want to be?
That was my.
Yeah, yeah.
I put a dollar sign next to both of those.
Yes, sorry.
And then section 3514, so sections 4 and 5, again, same section, we amend them twice. We're amending them this year, and then the next section amends it the following year. This has to do with the payment that goes to providers. In subsection A, we have language that payment shall be based on enrollment, period. So this is the conversation, enrollment versus attendance-based compensation. So this bill has come down on the side of an enrollment-based with this particular amendment system. And then in section 5, again, amending the same section 1 year out. This is requiring the commissioner to establish a payment schedule by rule that incorporates the total cost of care. Total cost of care meaning incorporating what the cost will be for providers under the tiered compensation system.
Well, there's a little dollar sign there, Nolan has indicated, for both those sections.
And then this language says that the commissioner is going to annually update it. This removes the STARS program language. It also removes language about the market rate survey, which we heard from DCF on today.
So what will happen if you remove STARS is that regardless of the quality or the level of STARS, that the child care centers will receive payment. So you're taking away any monetary incentive for improving, going up on the STARS.
This removes the link between payment and STARS.
Yes, so then the question remains, if you're taking away the payment incentive for STARS, for improving your quality, 5 stars, then what incentive is there, if any, for a child care center to change its level, its quality? And that's an open question, and I have that question. So it's just a question. Is there incentive that can be put in place that encourages quality improvement?
The bill doesn't
change the STAR system.
It doesn't change the STARS system. It takes away the payment, increase reimbursement for higher levels.
Oh,
It decouples.
That decouples.
I don't remember that was,
It's in there.
it is in there, but I don't remember that
Yeah, I know.
that was a conscious decision. I don't.
No,
But the bill's long, so, you know,
It's okay, it's not a conscious, it just happens a lot in legislation.
And just like the stuff that, there's language about in the pre-K section about the other accreditation, the BASI accreditation, and I don't think that was
I don't know.
necessarily.
To that point, for the record, the language of fiscal, I think the governor's proposing the same thing. That's what the equity payments are.
Right.
In the proposal to move away from STARS. This is essentially consistent.
This is consistent with what is in the big bill down the hallway.
Yeah.
And so when I saw that again, it was a huge question for me, because we've always had some incentive for quality improvement. So my question is, if we can do this and we can ensure that people are getting paid, but is there some incentive that we could put in place that links with quality improvement? It is a question. We don't need to discuss it right now, but it's a big question for me because I'm big on quality. Anyway, sorry.
Can I ask a question too?
Yes, you can, and then
The governor's proposal is getting rid of it, just assuming everyone's a 5-star equivalent, right? So it's just doing the same thing, just making an assumption that it's not, that it's now be the topper tier. Right, because that's what the 5-star.
That is what our.
So I'm just assuming, like, is this envision basically doing what the governor's doing, or just getting rid of stars and just having a flat rate?
it could do one or the other. That's the question. That's the question. So I was laying the question on the table, and you're absolutely right. Is this something we want to do, or is it something we don't want to do? And if we do want to keep stars, then how do we ensure that there's an incentive for moving forward, or we do not, or do we not have an incentive? That's my question, set of questions. So
Yeah, I think we should discuss it more. 'Cause
we will,
Yeah,
not now, but we will. I mean, ponder on it.
So many things to talk about in 2 weeks.
Yeah, we're gonna do it.
Yeah.
Go ahead.
Just a quick question on the childcare market rate survey. Are there surveys in the past?
Yeah, they do them every 3 years. I'm gonna look to Miranda's to, yep, 3 years.
You got it. Okay,
Okay, sorry, so much for high level. We've gotten into the weeds quickly. Section 6 is the childcare waitlist and application fees. This language basically says that a childcare provider can't charge a waitlist or application fee if the applying child qualifies for CCFAP. We have in section 7, the non-citizen childcare assistance program that would take effect not this year, but July 1, 2024. In section 8, this is also tied to the non-citizen childcare assistance program. Section 9 is a report back and special accommodation grants. So it sounds like the department may be providing some language alternative there. Section 10
and
is.
so 9 and 8, 8 is money, non-citizen is money.
Yeah. Section 10 is a continuation or an addition, I guess I should say, of the childcare workforce retention grants. So there's, the department had been speaking about the, I don't know if it was 7.5 in last year's budget that went out for workforce retention grants, and this is an additional 7.3 for that purpose.
I think there's money.
Then, yep, there is money in that. Section 11 is the scholarships for prospective early childhood providers. And current law, this is set to repeal July 1, 2026. This language would keep that program going on an ongoing basis. Section 12, appropriation, this appropriation scholarship for current early childhood providers. This gives an additional $500,000 in this fiscal year. And that is the transitional assistance. There's language about pause. Okay.
We're at a good pause.
And that's it.
Yeah, that was a perfect level flyby, but we did identify, a couple questions. Thank you, and we're coming back to this.
Nice job, Kate.
Change.
So, I mean, this is the message to the committee and to others, that we are going to be working toward markup. We're not done yet. We're working toward markup on this bill. And so if there are comments, specific comments to be made, please get them into us. And I am gonna be, based on testimony referred, I'm gonna ask Nolan to do a little figuring for us that may take it out, take some of these things out, but not in the bill, just so we're done, we can go offline.
All right.